between their gums and teeth, that twice a day is best. But for most people, once a day, and especially before bedtime, so that those bacteria don't have the opportunity to sit and have a party overnight under the gum line. To do that right before bedtime is ideal.
What's your philosophy on x-rays and how much to do the x-rays, how many x-rays you should get done of the full mouth, etc.?
I think anytime we can avoid exposure to radiation, we should. Now, quite frankly, it's impossible for me to practice thoroughly and be a quality dentist without good x-rays. I simply can't do it. I can't see in between the teeth. I don't have good x-ray vision. I have to have x-rays. So when we do take x-rays, we certainly use digitized x-rays. Digital x-rays use far less radiation than the typical x-rays, and I would recommend that for patients to seek out a dentist who's using digital x-rays. That's state-of-the-art, and a good percentage of the dentists in this country use those. Now, we can't say this for everyone, but I wouldn't recommend that people get a full set of x-rays more often than every 3 years, and a panoramic x-ray every 5 to 10 years. So we want to minimize the radiation exposure, and the best way to do that is simply by using digital x-rays.
That's great. There's been a lot of talk about teeth whitening, and I know I asked you this when I just came back from Marble Falls. There's different philosophies about teeth whitening and different ways to whiten your teeth. And for the purists, we're concerned about, would it hurt us? Will it make the teeth so sensitive that our teeth are uncomfortable? What's your philosophy of teeth whitening at this particular juncture of time?
Well, I'll have to say I've gone through phases in my practice. Of course, teeth whitening has been available to us now for 25 years. I certainly whitened my teeth. All of my staff had their teeth whitened. Most of my patients early on in my practice had their teeth whitened. They wanted them whitened. And then, of course, after I got sick, I became much more in tune with systemic effects of dentistry and am I challenging someone's immune system by whitening their teeth? There are very well-known and outspoken people in this world who would say it's not wise to bleach your teeth because it's a challenge to your immune system. I'll have to say that I'm in a group of very, I think, innovative and integrative and holistic dentists who have recently done a review of the literature about this, and we could not find evidence that bleaching teeth causes irreversible harm. So I'll have to say that currently, whereas I've gone for years actually without bleaching teeth, I think it's not an issue as long as a patient doesn't take it to an extreme. Bleaching, as you know, can make your teeth sensitive. And the reason is there's an ingredient in the bleach called carbamide peroxide, which breaks down, by the way, into hydrogen peroxide when it meets saliva. Hydrogen peroxide is, I think, a fabulous thing to have on our teeth. It helps kill some of the anaerobic bacteria in our mouth. But it can make our teeth sensitive. If it's making your teeth sensitive, as it does oftentimes on fair-skinned people, then you need to back off from it and bleach maybe every other day or every third or fourth day rather than daily. Also, it can make the gum tissue sensitive, and so if that's the case, then we simply need to back off. The other thing I would encourage people to do is I would not encourage people to bleach if they have mercury-containing fillings, because more of the mercury is produced and liberated off of the filling in the presence of this bubbling, effervescent bleach. So if a patient is going to bleach his or her teeth, I would certainly recommend that they have their mercury fillings replaced prior to that.
I was pretty surprised to find out that back in Los Angeles, when I had mercury taken out of my mouth, when I had 2 fillings taken out, and I had them replaced with composite, I was in shock to find out later that that composite that supposedly replaced the mercury had aluminum in it.
It's true. Many of the composite fillings do have aluminum in it. And the way to find out whether they have aluminum or whether they're biocompatible is that there are at least 2 laboratories in the world that I know of that can analyze a patient's blood or their serum to determine what dental materials they're most compatible with. And so materials that would have aluminum in it that are released out of the material would typically not be on someone's biocompatibility test.
Are you able to mention those labs?
I am. One is called Biocomp Lab, and interestingly enough, both are in Colorado Springs, Colorado, and the other is named Clifford Lab, Clifford. Both of them wonderful labs, each using slightly different methods to analyze a patient's serum, and so unfortunately, we do not get the same results from each lab. However, I will hardly practice without a patient having one of those laboratory results because it really helps us to know what materials the patient's most compatible with.
It's fantastic. It's so exciting, the work that you're doing. It's so complete. What's on the horizon for you in terms of continuous learning? I know you're excited about the biocompatible implants. What else are you looking at right now?
Well, I'm excited about the fact that I do see a shift in dentistry. 10 years ago, 90% of the dentists in this country were still placing mercury fillings. Today, it's slightly under 50%. It's hard to believe that still 50% or close to it of the dentists would still place a mercury filling, in my opinion, but we as dentists are so ingrained by our training that that's still going on. But by the same token, I do see real progress in the fact that fewer and fewer dentists are using mercury fillings. I'm excited about that, of course, for the health of our nation, but I'm also excited about that from a toxicity standpoint, literally from a pollution standpoint of our nation. The fact that we will, as a profession, finally, I think someday will have eliminated mercury will mean that we have eliminated the number one source of mercury into our environment in this country. So I'm excited about that.
Wow.
I'm very excited about the current research and what we have available to us now with DNA. I'm so thrilled to know that the protocols of some of the people who have really advanced the holistic side of dentistry are being proven out, because now we know that truly what they were suggesting is based on valid science, because truly the bacteria that we deal with in dentistry are among the most potent known to man. Actually, I'll have to say to you, Kim, that after 32 years of practice, I've never been more excited about the future of dentistry or about practicing dentistry. It's an absolute thrill for me to be able to go to the office.
I can tell. Not only do you have a state-of-the-art practice, but you have a wonderful spiritual family. Seriously, it was kind of like going to the Star Trek Enterprise, but with a ministry in it. It's great. One of the things I noticed in your practice is that you don't do anything that doesn't absolutely need to be done. Is it true that most people should have their wisdom teeth taken out? And what is your philosophy about that? And then I want to talk to you a little bit about braces.
You know, one of the things I said to my patients early in my career was, I think we need to remove your wisdom teeth because you're not able to keep them clean. I would certainly never say that to a patient now. There are wisdom teeth that need to be removed. Oftentimes they're coming in at an angle, they're putting pressure on the adjacent tooth, and they can truly be an issue, a health issue. But oftentimes in the past, those teeth that I encourage people to have removed, in my opinion now, should have been kept. Because wisdom teeth can be a wonderful thing to have in the future if you happen to lose another tooth in proximity to it. They can be a wonderful anchor tooth. We can teach people how to clean around their wisdom teeth. And if you have a wisdom tooth removed, you have a strong chance of developing a cavitation, as we've already mentioned earlier in the segment. So
Right.
I would now encourage people to keep their wisdom teeth if they are erupted into proper position and are not causing some kind of undue crowding of the adjacent teeth. So I certainly had a change in my philosophy about that over time.
My understanding as a young child and in my teens was that it's part of standard of care. Oh, you just get them out.
Well, that's right. You know, and you mentioned why am I so conservative about replacing fillings and crowns and that sort of thing? The reason is so often in dentistry, one thing can lead to another. In other words, we as a child will have a filling done. And of course,